My name is Amy Clance. I'm a nurse navigator at Atrium Health Navicent, and I'm here today with our large colon that is being loaned to us by Rump Shakers from Birmingham, Alabama. We'd like to thank them for loaning it to us. But I'm here today to talk briefly about colorectal cancer. March is Colorectal Cancer Awareness Month, and it is one of the leading colon cancer diagnoses in Georgia and in the country. So if you'll follow me. So when we detect colon cancer, one of the top ways to do that is having a colonoscopy. And what the doctor is doing is using a small camera, goes into the colon, and he's looking at the tissue. And what we really want to see is just like this, pretty normal colon tissue, very pink, pretty and smooth. That's what we like to see. However, there are times when they find other things. So if you'll come follow me, sometimes the doctor finds polyps. These polyps can be benign, meaning non-cancerous, or they can become precancerous. So what the physician does is, with that small camera, puts a little hoop of it around it and takes it right on out. If the doctor's able to do that, it doesn't turn into cancer. We don't allow it to have the opportunity. We have some malignant polyps. These are polyps that have been in there long enough that they started to change into cancer. You can see it gets red and has funny shapes throughout it. It's turning into cancer. Okay? Sometimes that can, on occasion, be removed. A lot of times we have to have surgery. Also, the doctor can find types of inflammatory bowel disease, such as Crohn's disease. And you can see how it makes these lesions in the colon. Causes a lot of pain, causes bleeding. Also ulcerative colitis, which is another type of inflammatory bowel disease. Patients who have these diseases are at a much higher risk for developing colorectal cancer due to the constant inflammation. This right here are pictures of what a colorectal cancer looks like. This is an advanced cancer, and you see it's all odd shaped. It's not uniform. It's raised, and what it does is it'll evade the tissue into the inside. On this side, you can see where it's just starting to change and it hasn't gotten so big yet. It is very important to get screened for colorectal cancer. We're starting at age 45 for people of average risk. If you have a family history of colorectal cancer, you definitely speak to your physician. You may need to be screened much earlier than that. Okay, talk to your healthcare provider. There's multiple ways of getting screened with a FIT test, using a stool test, a stool DNA test, and also definitely a colonoscopy. You can call 478-633-3000 for any other questions.